Hi, everyone, and welcome to the very first episode of Inner Landscape. So, we are a bunch of trainee clinical psychologists from different backgrounds sitting down together for some real talks on mental health, cultures, and also healing. So, this video is brought to you by the iHeart Family Psychological Service Provider. And even though this is a podcast and it's pre recorded, we would love to hear your thoughts. So, please feel free to comment and join the conversations. So to begin with this first episode, let's each of us share a little bit about our journey into the field of clinical psychology. Maybe we start with Najat first. So what's your name and where are you from?
Hi everyone. I just wanted to thank you for joining us. So my name is Nichad Suleiman Abdurrahman. I'm from Somalia and currently I'm a trainee in Malaysia.
So what inspired you to study clinical psychology, and is there any turning points or any key challenge along the way?
Okay, it's a long story, but to keep it short, basically I did psychology during my undergraduate. So I was already interested in psychology, but the reason why I picked clinical psychology specifically was one of my professors was like really helpful to me and taught me a lot. So I think she was like my main inspiration. But outside of that, I would say it's just seeing. Basically, I wanted to help people with mental health problems. So to me, the way I perceived it at that time, being a clinical psychologist, the path or the kind of help I want to offer. So yeah.
Okay, all right. Maybe I share a little bit about myself as well. So my name is Castle, and I'm from Kuala Lumpur, Malaysia. So what inspired me to study clinical psychology is that very similar to what Najat said. I always have the passion to help people, but there are many ways of helping people in general. I used to be a real estate agent. I used to be in the corporates doing marketing, doing sales and all that. But I've come to a point to realize that helping people, of course, my original passion was to help people with special needs. In particularly when we talk about mental health, right? So not everyone can do that. For me, it sounds kind of cool, when you know how to read people's mind. But I realized that when I studied my degree, and we don't really read minds, we just study how human mind works, right? So from there also, I kind of like get a better understanding from there, and I know okay, clinical psychology is the pathway I really passionate about. Um, Unfortunately, my result was not really that fantastic. Therefore, I actually waited and I continued to work in the corporates until very recently I started to look back what are the universities that actually offering the Master of Clinical Psychology. And here I am. So, yeah. So, what about Dodi? Can you introduce a bit about yourself?
Sure. So, hi everyone. My name is Naima Dodi, but you can call me Dodi. I am from Pakistan, but I was born and raised in the UAE. And what inspired me to start studying psychology, first, when I was, trying to figure out what to study for my undergrad, it was just the best option at the time because I'm not really a business student. Neither am I a, science student or like an IT student. So I was always, very interested in social sciences and soft sciences. So um, this seemed like the best option at the time, and I'm so
Mm.
glad I chose this. And then why clinical psychology? Because I did my undergrad in counseling, but why I moved towards clinical was because I think it encompasses like very different, like all the age groups, and I can work with adults, I can work with children, I can work with adolescents, I can work with a lot of different age groups and types of people. So that again, like the main core is to actually help people, right? The main objective is to help people. So this way I can help the most amount of people that I possibly can. Yeah.
That sounds very interesting. Yeah, very interesting. So yeah, linking that to the next question that I have for everyone, right? So in our own countries, So how does this mental health generally understood? Right. I just explained a little bit about Malaysia context. Yeah. So here we have three different major races, and all three races also kind of having a similar perception about mental health. We call it a stigma. And if you don't have any major problems with your mind, so to speak, people call it crazy mind, people generally tend to not bother about it. So we just, okay, maybe you are sick, you need to see doctors. But when it comes to mental health, very rarely you see parents or even individual themselves come and seek for psychological help. So what about your own country then?
I can honestly relate to the points you said because a lot of stigma in my country for sure when it comes to mental health, and a lot of time people see it as a weakness, as in like, oh, you're a weak person, like why can't you just suck it up, just deal with it, kind of thing. That's the vibe. I get it. We get it back home, and also another thing is people don't really think it's a real thing. Unfortunately, it's either you're sick, you have like physical problems, or you're just faking it basically. That's the main thing I would say. And another thing to add on to it is they kind of assume if a person's having that, then maybe something's wrong with their faith. Because in Somalia, we're mostly Muslims. So a lot of times, the stigma of like, okay, you're weak, the stigma of like, okay, maybe you just need to pray more. You know, you can imagine a person having mental health challenges. You can imagine them being told, oh, there's something wrong with me, as in it's your fault for having it, which is not the case, of course. Unfortunately, that's the mindset for the majority of people. But nowadays, I'm so glad, like with social media, people are getting more open to it and actually accepting it. And from there, I can see my parents, you know, they're more accepting it, and I try to tell them, like, okay, that's not me, that's not true. So I have high hopes for it, but yeah, for now, a lot of stigma to deal with. Yeah. What about you,
What about
Jordan?
yeah.
Yeah.
Well, it's very similar to Somalia. There's a lot of stigma around, and again, because Pakistan is a Muslim country, so the initial, um, how do you say it, accusation goes to, oh, something's wrong with your faith. Um, but so I'll talk about how it was before, and I'll talk about how it is now.
Sure.
So before, like the previous generation and everything, it was the same. Like you would be labeled as crazy if there was something, if you were crying for no reason, or if you were experiencing any type of depressive symptoms. It was, you were labeled as crazy, or like, you'll get over it. It was brushed off, and not taken seriously at all. And I guess now, and not just like in families or in just in general in Pakistan, but even the psychological, like, society in Pakistan, they were not taken seriously. Like, psychologists were not taken seriously. There was no set process you would have to go through to become a psychologist. Like, anyone could start practicing without a license. And yeah, so that was pretty dangerous. But now there is a set process that you have to go through, because the scope has increased so much, and people are now realizing that how serious mental health and how complex it can be. Because especially in this generation, I feel like, because suicide rates and after COVID especially, so many people are struggling with mental health. There are so many statistics out there, and how mental health has increased globally, and there is a dire need for clinical psychologists out there. So that is Pakistan. But if I'm talking, because I was born and raised in the UAE, so I'm part, like, I know a little bit about that culture too. And I've worked in the mental health sector in the UAE before. So I would say it's taken very seriously there. The entire process of becoming a psychologist, of becoming a clinical psychologist, is very, very thorough. It is extremely perfect. Like you have to meet everything perfectly to become a clinical psychologist there, which in turn tells me that, it's taken seriously. Like they want people that can truly are qualified and are licensed to help others to be helping others. Yeah. So yeah, so that's really good. I'm glad I come from a culture like that as well. But I'm also happy to hear that in Pakistan, slowly, like very slowly, but it is, peeling away some of the stigma, and people are more accepting and more welcoming of mental health issues. Yeah.
Well, I agree with all of you regarding the awareness and all that. The stigmas is currently being dealt with, but we still have a long journey to go. As far as I can tell, yeah. In Malaysia, currently, we have the latest statistics back in 2023. There were about 1 million in the total population of Malaysians. 1 million are suffering from depressions, which is about, if I'm not mistaken, it's about 4.6% from the total population. So I think it's really a long way to go, but I'm glad that we all are actually moving forwards from there. So any particular what do you call that? Particular um, taboo that you are currently facing, the population are generally facing nowadays? Is there
I
anything
mean,
you can share about this?
do you mean regarding mental health?
Yeah,
Like,
a misconception or a taboo.
that we have a long way to go when it comes
Mhm.
to raising that awareness. Um, Even within my culture, there's a lot of misconceptions for mental health. And unfortunately, what I've seen, because before I came to Malaysia, I went back to my country that I was staying there for a bit, working. What I've seen, unfortunately, is even like certain doctors don't even take it serious, unfortunately. So they don't even tell the patients to go and see a psychologist. Another thing is like people don't even know there are therapists available, clinical psychologists available. In my country, there's like the small amount of clinical psychologists available, but even them, they have hard time like getting people to come to them. So there's a lot of times you have to tell them, okay, like this is what we offer, and inform even people in the medical field, this is what we offer. Please like refer a patient that need us. So that's one thing that was quite surprising to me when I saw other doctors are not taking it serious. And of course, one of the main taboo is just it being it's you have mental health problem means your faith is weak. That's the biggest taboo, misconception. And another taboo is mental health is associated with shame,
For sure.
and because of is a culture whereby shame shouldn't be shown. Like my culture is more of like, if you have some problems you have to hide it, or else it's shame to the family, shame to people you relate to. So because of that, a lot of times you will see families that one of their members having like really severe mental health disorders, but they just hide it. Just they don't show it. They even sometimes make sure they're not seen by other people because of shame. And that's really sad. Have you seen something like this in Pakistan?
Yeah, for sure. It's the exact same in Pakistan, like the exact same. Like it's shameful to have someone who's mentally going through something and is physically okay. But I think a common misconception in Pakistan is there are two. First, that we can read their minds, which is not true. It is humanly impossible to read someone else's mind.
Oh yeah.
I do admit that clinical psychologists do have a certain level of judgment. They do have a certain level of understanding and empathy, but that doesn't mean that I can read your mind.
I mean, sorry to interrupt you. It's more of like we observe.
Yeah.
Again, like we always
Yeah.
communicate with our body how we feel.
Yeah, sometimes we can pinpoint what the other person is trying to say a bit quicker, but it doesn't mean that I can read your mind.
If we could, my job would be easier.
Exactly. Like I think half of the world's problems would disappear if we could read each other's mind. But and the second misconception is that if you're a psychologist, that means that you're crazy yourself. That's a very common misconception in Pakistan. um,
Wow.
yeah,
So I
the
can
amount of
imagine.
people, yeah, whenever I went, I think when I went last was in January this year, but before that, when I went like about 3 years ago, a lot of people were asking me that, what are you doing? What are you studying? And I said, I'm, doing psychology. And they're like, oh, you must be crazy yourself. You're gonna go crazy. So many people said that to me, and I'm like, why, what? Like it just didn't make any sense to me. Um, yes, okay, in a sense, this is something that my dad has always asked me and always, made sure that I keep in mind is that, to have a certain level of barrier to not let, the issues affect me, like, people's issues affect me, like mentally, because of course, like sometimes our clients go through some really, really overwhelming and really intense um, and distressing situations, and that can have an impact on us as well, but it's really important to have that barrier and to have that distance so we protect ourselves as well.
Yeah.
But other than that, doesn't mean that I'm crazy myself. Does not mean.
Wow. Like if we even the people working with mental health issues, like we're being labeled as crazy. Imagine someone with mental health disorder, how they're dealing with and being labeled as even way crazier. That is
Yeah.
actually sad, which is not the case. I'm not gonna lie, I hate that word crazy. Every time
Yeah,
someone says, I tell them
honestly,
don't say that.
it sounds bad in every single language.
Yeah, it does.
It sounds bad in every single language, but I do want to say one thing is that even though there's more awareness now and people are more accepting, I think there should be another shift and another introduction of teaching parents and teachers how to deal with someone who's struggling with mental health. I think that plays a very, very big role. I think most of my clients that come to me have said that, oh, I have issues with my mom, I have issues with my dad, I have issues with my grandparents, I have issues with my siblings. To teach families how to deal and how to talk to someone who is struggling with mental health.
What do you think, Cassie? I
Well,
agree.
yeah, totally agree with that. And I'm surprised that we all share similar taboos and also misconception. And when I first studied my degree in psychology, my friends were like, "Wow, you can read mine now." And then when I study my clinical psychology at this age, right, I'm in my middle age now. So my friends were like, "Wow, you are getting crazier now."
Yeah.
So,
Wow.
what are you up to? Are you trying to interrogate us? Are you trying to, really, really do a psychic magic on us or something like that? So I was like, well,
Exactly.
no, exactly. So I was like, these, at least my peers are still having these conceptions, which I was a little bit sad, but at the same time, at least they are aware that at least someone is venturing into this field of studies. So at least they know where to reach out for. But what do you see about this particular generations? Do you see improvement for younger generations due to maybe what you mentioned, Najat, the
Yeah.
social media? Do you
Oh
think
yeah.
it's generally improving?
Oh yes. Oh yeah. Like I've seen they're able to because of social media, they're actually more aware of certain
Mm.
disorders, certain symptoms of certain disorders. They're also more accepting, I would say. Um, However, there's like it's how can I say it's like a double-edged sword in a sense, whereby they are aware, but some of them self-diagnose. And that
Mm.
is not good, you know. So I've seen both sides, but I'm glad they're more aware in a sense. I'm more open to therapy, even though it's still this level of hesitancy, especially when it comes to like Somali clients. It's more of because of the family, you know, it's no one is gonna support them to get that help, and no one is gonna not only this limited access to the help, it's also lack of support from family for them to get the help. But other than that, the awareness is higher for sure. Yeah.
Yeah, 100%. I would also like to point out, when I was growing up, I would watch a lot of YouTube videos and I would follow a lot of YouTubers, and most of them now are parents. And I do genuinely see a very big shift in their parenting style, like how they talk to and how they're so much more open with their children. And so I think, how we mentioned social media, I think it's a good thing that, they can see that it is possible to talk to someone with, or like just be more empathetic, be more understanding, just in general. Yeah.
It is really important thing. But I'm also sometimes, how can I say, I always find myself I have to psychoeducate about how, okay, if just because you have one symptom from one disorder does not mean you have disorder. It does not mean. A lot of times when we're diagnosing, we have to really like do a thorough interview and check through if, and also we have to also make sure this is not due to other things as well. But, that's when we give the diagnosis. But that's why I really, if anyone is listening, like there's one takeaway you want to take, like do not self-diagnose. It's actually more harmful. Yeah.
But it sounds like there's a lot of things to learn, yeah? It's not merely learning some philosophical ideas or some theories behind. So back to the original question, right? If someone somewhat interested in studying psychology, what would you advise, or is there any insight you would like to share for someone who is generally interested in knowing more about psychology? I personally feel that that if someone is interested, they must also understand that they need to really interested in how human behave, or how human think, or how even human feels. That's the very least that they have to be passionate about. Because I personally experience it myself. I talk to my nephews and talk to my niece and all that, and they are interested in some of the phenomena. For example, why people get addicted to certain things, why people are I don't know, for example, pornography and so on and so forth. But they are not interested in knowing what is running behind their back. So they just want to know what is the cause and the consequences. But whatever is running behind their back, they are not interested in it. So I can clearly tell these people, they are not suitable to study to study the psychology. Then what about any other tips that you want to give for anyone who is interested in psychology?
Honestly, looking back at it now, one tip I wish I had is, in this field, it is, first, it's not easy. It is definitely not easy. I know a lot of times people, whenever they think about therapists or clinical psychologists, they always imagine someone just, asking you questions. And that's it. Like, it's so much more. We do so much work behind the stage, there's everything you have to process, everything you have to process, we have to learn, we have to read. So it really requires a lot of hard work. So make sure you're willing to give that, and make sure that how can I say that? Your reasoning of doing it. Because a lot of times we're doing something and we don't get the reward, satisfaction immediately. Sometimes you're doing all of this for a client, and then let's just say, you can't really change people unless they want to, unless they want to change themselves. So sometimes you have so much effort and then nothing comes out of it. So you're like, you get sad, which is normal. But then you have to also at that moment have your deep reasoning, like your main reason of why you do this. That's way outside of everything else. It's just personal to you, and it's unique to every person, of course. That's one thing, honestly, I would give. And another one to add on to that is, in this field, you're required to work on yourself too. That's the thing. That's the thing. You cannot avoid your own problems. Anything we preach, we actually need to practice. And sometimes, to this day, I'm having that challenge. I don't know if you guys can relate, but some of the things I'm like, it's hard. It's really hard. Yeah.
We have to cut ourselves, open the wound, and
Yeah.
see for ourselves.
Yes.
Yeah,
What about?
I think because you're so wired to create that safe space for someone else, it's really important to create that safe space for yourself as well, so that you can reflect and heal from any past problems, any past trauma that you have. And I think that one tip that I would give someone who's interested in this field is to basically um, be flexible. Like, not everything is gonna go your way. Not every client who's struggling with the same thing is gonna have the same problems. To just be flexible and understand that you have to be non-judgmental, you have to be very empathetic, you have to learn how to validate and understand emotions, and also to unlearn certain things that may hinder the process. So yeah, it's to just be really, really flexible. And even if they come to you with something that you don't believe in, or something that you think is very minor, or something that you think is just something that's silly, is very important to never make them feel like that and say that, oh, you should not be feeling like this, or you should not be doing something like this. No, everything is valid to them, it's important to them, and that's something that we really need to work hard to understand.
All right, so this sums up quite a bit, yeah. So the final question, so what do you hope the viewers who are watching these videos to feel or gain from this series?
Honestly, I just want them to just understand from our perspective, normalize, and just be willing to learn, because we're willing to share our knowledge with you.
Right.
And I think to just let them know that it's okay to not be okay. It's
Yes.
genuinely okay to not be okay, and to reach out whenever they do need help, because I have this dream that I want to sort of work towards, reducing suicide rates and self-harm rates, because it's very, very common now. It is so common now that it's scary how much people have delved into unhealthy coping mechanisms. So if there's ever an issue, if you ever feel like you're going towards that route, to always, always reach out, because there's always people that are willing to help. So yeah.
That's a very good point also. All right, then I think due to time constraint, I would like to just do a small recap and what's going to come next. So this is anyhow just the beginning, and let me just give you a sneak peek about what's going to come next. We are going to cover some more topics like burnout, therapy, methodology, what is the myth, what's the facts, so on and so forth. And we will probably invite some guest speakers as well once in a while, and see what are the current topics and also relevant to the general publics. And of course, we will go deeper into like a very mental disorder specific. So, for example, depressions, anxieties, OCDs, and so on and so forth. So we will definitely cover some of these topics in the future. So anyway, thanks Najat and also Dodi for joining us today, and we will be the main co-host, and thank you so much for joining us, every one of you. And we are so excited to keep growing this space with you, so you can talk about mental health honestly and what is going on in your mind, like what Dodi said. Don't be afraid to say not okay, yeah. So if something in today's episode resonate with you, please share that, tag a friend, or even drop your own thoughts in the comment sections below. We really love to hear from you. So is there any other topics that you're interested in knowing? Also, you can pop into the comment section as well. So we are signing off from now. Take care, talk kindly to yourself, and we will see you in the next episode then. All right, see you.
Thank you.
Bye-bye.
Bye bye.